In this scenario, the nurse, Demario, comes in to give the patient, Trevor, wave Trevor, information concerning his last test results. He will also give Trevor advice on how to cope with his new illness. Demario will be demonstrating therapeutic communication.
Man. Hello, Mr. Myers. I'm Demario Brown. I'll be your nurse for today. And I'm just going to discuss with you your test results. This probably wouldn't take any more than 15 to 20 minutes. And we'll be on our way. So, Mr. Myers, what we found in the test results is that your glucose levels are a little high, which means that you're probably getting a few extra sugars in your diet, or it may be something genetic. Do you know that anyone in your family was diabetic at any point?
No, not at all.
Okay. So what we're going to do is we're just going to monitor it for a little while, maybe have you try some different things as far as food goes and exercise daily, and because the doctor doesn't want to put you on medications right away. And that's just because it's a little early to determine it, and we see these things from time to time, so what we're going to do is just monitor it for a little while. So I'm going to go back out and discuss with the doctor any further plans and maybe a diet plan, and I'll be back in to see you in just a few minutes.
Okay.
Thank you, Mr. Trevor, for your time. Have a good day.
In this next scenario, I will be taking the vital signs of a patient. I will be using AIDET to do so. With the A, I will acknowledge the patient. With the I will introduce myself. And then I will, with the D, tell them the duration of how long it will take. And then with the E, I'll explain why I'm doing so. So I'll explain why I'm taking their vital signs. And then with the T, I'll say thank you.
Hey, Mr. Brown, I'm Caroline. I'm a student nurse at Mississippi College, and I'm going to be taking your vital signs today.
Okay.
It'll take about 5 minutes, and I just needed to get it done so I can check to see where you are.
Okay.
Okay, great. Looks like you're all healthy. Thank you so much.
In this next scenario, the nurse Trevor is educating the patient, Brittany, on how to manage high blood pressure. The patient asks the nurse the question, and he does not have the answer. Trevor will use therapeutic communication to handle the situation.
Come in.
Hey, I'm Trevor. I'm going to be your nurse today. How are you doing?
Good.
It should take about 15, 20 minutes. We're going to talk about the blood pressure. It's been pretty elevated the past few visits you had. So have you had any sodium, what's your sodium intake, or what do you eat?
I like fried food. I like chips. I like candy. Does this have anything to do with genetics?
Oh, I'm not sure, but let me get back to you and I'll find out.
Okay, thank you.
In this scenario, the nurse Brittany is interviewing Demario, an 80-year-old patient. Brittany will be demonstrating non-therapeutic communication.
Hey, Mr. Brown, my name is Brittany. I'm going to be your nurse today.
What?
My name is Brittany. I'm going to be your nurse today.
Oh, hello.
How are you?
I'm fine.
So what brings you in today?
My nose has been hurting.
Your nose has been hurting? My nose hurts sometimes too. Did you see the weather we had yesterday? We got like 2 inches of snow.
No, I didn't see the weather.
In
My
Mississippi.
face was hurting too bad.
Well, okay. Do you have a girlfriend?
No, I have a wife.
Oh, that's unfortunate. Have you tried the cookies in the cafe? They are so good.
My nose is hurting.
Okay, I'll go back out like in this. Okay, our first stage as principal is to establish rapport. It's important to establish rapport with your patient within the first minute. That way your patient is more likely to give you information that they wouldn't if they didn't feel comfortable with you. Clear objectives is the last thing that we're going to talk about, and this is important especially when you have a nurse-client relationship, because if both are clear on the objectives, especially the patient, and what goals that they are to attain, this makes it a lot easier in communication. And last but not least, when you're entering a patient's room to do any type of assessment or to give them a bath or anything, You let the patient know exactly what you're going to do, how you're going to do it, and how long it's going to take. And these are all examples of a clear objective. What you just saw was an example of nonverbal communication. Also, when you're using nonverbal communication, you want to be sure that your patient isn't confused as to what you're trying to get across to them when using your nonverbal. For instance, if you don't want them to think you're mean, then they'll just stare at them like this. Smile, be friendly with your patient, and use clear-cut language that they can understand. Your developmental level is also very important, because if you're speaking in a jargon like formal pseudokinetics, then your patient probably does not have a clue what that means. So, be clear in your language as far as what you're saying so that the patient may understand the language as well.